Um, all these maneuvers have already described. They should be done on Rubens 2, reverse wood screw, delivery of the posterior on the all four position. All four position are the patient should be on their hands and on their toes. So that is called the Gaskin maneuver. And every maneuver, if they are all these maneuvers are failed, as well as the Gaskin maneuver all fail, so we can go another destructive maneuvers. So destructive maneuvers are clitotomy. What will you do in the clitotomy? You have to apply the upward pressure over the mid of the clavicle or the medial or lateral, medial one third and lateral two third of the clavicle to break the clavicle so that the distance between the shoulder can be reduced and the baby can be delivered easily. Number two, Zavinelli. In the Zavinelli, as the baby's head is outside and all maneuvers are failed and there's a facility of cesarean section, so the baby's head should be bring in the occipital interior because the baby is delivered in that position. So it should be occipital interior. It should be flexed and it should be moved back in the maternal pelvis so that now apply the continuous pressure until the baby is delivered through the cesarean section. Third maneuver is abdominal hysterotomy. You can perform the hysterotomy. One person or the assistant can do the reverse wood screw or wood screw manner through the abdominal approach and baby can be delivered vaginally. If all these maneuvers are failed, the last maneuver and the facility of cesarean section is not available is symphysiotomy. What is symphysiotomy? Symphysiotomy is there is a cartilage over in between the two bones of between the two pubic bones is a fibrous cartilage. There is intentional division of this cartilage that will open up the space for the shoulder and the baby can be delivered easily. After the delivery of the baby, you have delivered the baby. As you can see, after the delivery of the baby, you have to put the baby on the maternal abdomen. Do the early essential newborn care. Delay the cord clamping. Active management of third stage of labor. Active management of the third stage of labor, as well as the deliver the placenta with the Brand embryo method. And now you have to check for the all the lacerations, third, fourth degree perineal tears, and you have to check for the baby as well. I will tell you about the post-op care later on. But now the most important component is the documentation. What you have to do in the documentation, first of all, you have to write down the time of the delivery of the head. Then you have to write down the time when the diagnosis of the shoulder dystocia has been made, the time when the help has been called, the time duration between the delivery of the head and delivery of the body of the baby. This is very important. And then you have to write down the duration for which each maneuver has been done, for how much time each maneuver has been performed, and the list of the members or the list of the attending doctors or the team who are present there. They should also be write it down. And the most important thing is the debriefing of the patient and the family, and discuss every event of the family with the every event of the delivery with the patient as well as with the family, so that if any complication occurs, and all the complications should be told to the patient and the family. If any happens, so they already know about that. In the post-op period, as I already told about, you have to see the after the delivery placenta for third and fourth degree vaginal tear. You have to observe for the bleeding to rule out the PPH, and you have to see any vaginal or cervical lacerations, and you have to plan for the patient to monitor for the postpartum depression. All these events should be reported in the risk reporting register, or should be reported, and these risks and should be discussed in the risk review committee. And for the baby, you have to see the neonatal pH, and number two, you have to see for the baby weight as well as his or her Apgar score, and there should be the close follow for the baby. This is all about the shoulder dystocia. Hopefully you can understand this video. Thank you.